Okay, this is oral care for a patient with dentures. It's important that you remember all the indirect care portions of this as well as the skill itself. So I'm going to start. Knock, knock, knock. Hi, Ms. Jones. I'm Jennifer, your CNA. I'd like to perform oral care with dentures. Is that okay?
Yeah.
I'm going to wash my hands and get my supplies. I'm washing my hands. My supplies. Okay, I need a towel to protect the clothing. And my hands are clean so I can get my supplies out. I do not need barriers when I'm doing this skill until I'm actually doing the patient care. You need barriers to set everything on. Use a barrier for that. I need water for them to rinse their mouth. I need the basin for spit in. And I need to close the curtain. When you use a barrier, make sure you only handle it with one hand and throw it away. Don't crumble it up in your hand. That's a big no-no. All right, so I'm going to raise the level of your bed. You need to make sure that when you're doing any skill with the patient in bed that involves putting anything in their mouth, the head of the bed always has to be up at least 60 degrees. I like to raise it to make them look like they're sitting up completely. When you're sitting your patient up, it's important to move the overbed table because you don't want them to get injured by hitting it. Is that comfortable for you?
Yeah.
You can't ask, is that high enough? Because then you're getting help from the patient. Okay, so I'm about to start patient care, so I'm going to put my gloves on. Make sure you have gloves that fit you well enough so that they're not too difficult to put on, but they're not so loose that they're really baggy. Okay, may I have your dentures? I'm going to set those aside. I'm going to put your clothing protector on. Would you like to rinse your mouth first?
No, you do.
Okay. So what I'm going to do first is I'm going to dip the sponge in the water. I'd like you to open your mouth, please. And when you're doing denture care or oral care with gums, you just do one big swoop and you're done. You throw it away immediately. Would you like to rinse your mouth? Yes, please. Always make sure that you leave the mouth clean and dry. I'm done. I can put this in the laundry. We'll pretend that's my laundry. Now I'm going to come over and I'm going to do denture care for my patient's teeth. First thing I'm going to do, come around here please. I'm going to put a towel in the sink to protect the sink. And I'm going to drain my dentures. It's kind of like draining vegetables. Take the denture out of the cup. And that's when I start turning on my water. You want to make sure that you have a slow, steady stream of cold water. Your sink is going to fill up. It has a overflow hole. It's okay. First thing you want to do after you take your dentures out is rinse the cup and fill it with cold or tepid water. I prefer to use cold water. Get your toothbrush wet. All you need is a pearl-sized drop of toothpaste on your toothbrush. You don't need the big ones that show in the commercials on TV that you need this big glob of toothpaste. All you have to do is scrub all the surfaces of the denture, the part that touches their gums and their mouth, and you rinse it. You don't have to sit here and scrub it forever and ever like you're trying to get dried on, caked on, baked on, burnt on cheese off of a cookie sheet. This is just a skill. You're going to make sure that you hold the dentures firmly so they don't flip out of your hand when you're brushing them. And you're just going to clean them. Doesn't really take that long, but you want to make sure that you get all of the toothpaste off. Drop your clean denture in the cup. Rinse your toothbrush. Turn your water off. I like to get the extra stuff off of my gloves. Ask your patient, would you like your dentures on your table here, or would you like me to put them away?
You can put them away.
Okay, so if I put them away, have my gloves on. My gloves are contaminated now. I'm going to use a barrier, to open the drawer, but my cup is drippy, so be cautious of that. Maybe I didn't dry it off well enough, because they're looking to see if you're putting things that are wet away. This is dripping. I don't know if it's cracked. Okay, so use my barrier, put my items away. I'm going to leave that open because I have other things to put away too. I'm going to put my toothbrush and toothpaste away. Use a barrier to close my drawer. Never use your leg or your body or the back of your glove. I'm going to dry my area here. Get rid of your water. I need to clean my basin. All you have to do is rinse it and dry it. Make sure whatever you're drying something that's drippy or wet, do it over the sink. That way you're not making a mess on the floor and you're not making a dangerous situation for you or the evaluator. Oops, this goes in the second drawer. Throw my barriers away. Leave the tabletop clean and dry. The last thing that you should do with your gloves is take the barrier out of the sink that's protecting the dentures from dropping and breaking. That should always be the last thing you do. Take your gloves off. When you take your gloves off, they have to have your fingers pointed away from you. Not like this, but like this. You're going to always grab the palm of the first glove, inside out, crumble it up. 1 or 2 fingers on the inside of the glove. Don't get caught with your thumb on the outside. Pull it off, throw it away. I'm washing my hands. Here's your call light. Would you prefer to keep your table in front of you, or you want me to move it?
That's fine.
Would you prefer for me to put your bed down, or do you want to keep it up?
It's fine up.
Would you prefer to have a magazine or a newspaper or your TV on?
No, I'm good. Thank you.
Okay. I need to open the curtain using a barrier. Jeez. You notice I'm not crumbling up the paper towel. Use it as a barrier and you throw it away. Okay, I didn't raise the level of the bed, so I don't have to put it down. I asked her about preferences about the table, the level of the bed, and newspaper, magazine. She has her call light. Everything is clean and dry, put away. I'm done.